to start in the UK and then we'll go to Australia. So, Linda from Deepak.
Right. Well, I think everyone knows that the care system that we have is in complete crisis. It's totally unfit for purpose. We know what's wrong with it. We know some of the things that we want to put it right. But I think we need to think about exactly what we want to put in its place, how it could be put into place, and to some extent I'm probably going to play devil's advocate in relation to this. I have done a lot of reading for this on systems in Norway and Sweden, which are often held up as being wonderful and the thing we should aspire to, but actually I noticed there are a lot of issues with those, sort of in terms of accounting for your direct payment. People have to account in detail what they spent money on every 6 months, and any underspent money they have to pay back. I don't think that's something we want, because people need to be able to carry unspent monies over for specific things. I don't think people want to account every 6 months. I don't think it's necessary. I think we need to look at reassessments. People definitely don't need to be reassessed every 12 months, because if you have a lifelong impairment, it's not going to get any better. You might need more help, but you're certainly not going to need less help. So I think all those things are the things we need to sort of try and discuss.
Lovely.
Okay, so at the start of this year, I got a Winston Churchill Fellowship, which anyone in this room, providing you're a British citizen and living in the UK, can apply for. And they basically allow you to do non-academic research on the subject of your choice. And I chose to go and look at leadership in disability in Australia and New Zealand. As I mentioned to Roy, I'm not going to talk about New Zealand because it doesn't relate to independent living. But when I went to Australia, I started asking people about leadership and disability. But all anyone wanted to talk to me about was something called the National Disability Insurance Scheme. And basically, about a year prior to my visit, Australia had had, by public vote, the decision to increase taxation for the whole population by 0.5% to set up a support service nationally for disabled people to provide independent living support. When I started to talk to people, what kept going through my head was, this is a bit like ILF, so the Independent Living Fund. And everyone kept going to me, can you tell us about the Independent Living Fund? Because that's the model that we want to try and implement in Australia. When I went, they were just starting to do the implementation of the National Disability Insurance Scheme. And people were really, really nervous. They were nervous because the rollout wasn't happening consistently. Every territory, so a bit like county of Australia, was rolling it out in a different way. So I went to one place where they were doing it by age. So they started with 0 to 5-year-olds, then they were doing 0 to 8-year-olds, and they were going up like that. Another area I went to visit, they were doing it by location. So they were like, if you live in these areas, then you get access to the National Disability Scheme rollout, and then we'll gradually move it to the more populated areas. What was apparent is, although the principles that underlie the National Disability Insurance Scheme are sound, and it's about independent living and having the support you need to live, the practice of rolling it out has not been going very well. There are massive conflicts because Australia, much like the UK, has a very strong history of institutionalisation, and there are a lot of disabled people still living in institutions. There is also issues around, they have never had kind of system like this before. So to build up an independent living approach when all you've really had is institutions is quite scary. So at the moment it's not working very well, at least according to the activists that I'm still in touch with, because people are being forced out of the support that they have because of the introduction of the National Disability Insurance Scheme. But because the rollout of that scheme is not happening all in one go, people are not necessarily getting the new support that they should have. I think one of the main reasons why I was asked to come and talk about the scheme is, although it's flawed, what was really, really interesting about the National Disability Insurance Scheme is that disabled people's organisations, so organisations run and controlled by disabled people, managed to lobby and campaign with the general public to get the general public to support an increase in taxes. And that is really, really interesting to me. There are lots of other reasons why that might have been an easier conversation for them to have, because there are less disability charities in Australia than there are here, and there are more DPOs, and the DPOs that there are funded by the government, but that comes with their own challenges. But the thing that I found most interesting was that they managed to create a campaign that could engage ordinary Australians in the need for an independent living fund, essentially. And I think that's what's interesting about what I've seen in Australia. And I'm wondering, I guess my question is, what can we do to communicate the importance of independent living for the whole of our society and not just for disabled people, because that's what they managed to do in Australia?
I think that's a good question. Is that a good question? Good place to start?
Can I ask a couple of questions?
Yeah.
So, is it means tested at all, or is it free?
It's you have to have an assessment of, well, unfortunately, of course, but I don't believe it's means tested.
And who does the assessments?
That I'm not sure of it. They've got, so the National Disability Insurance Scheme has been set up by the government to be semi-autonomous. And they actually have offices in each of the territories, so in each of the regions that administer the scheme. One of the things I found very interesting is, well, and this is a broader perspective from my experience in Europe, there isn't anything like access to work anywhere else in the world. And actually what the National Disability Insurance Scheme was going to do in Australia was to bring something akin to access to work into existence, as well as all of the other support. So it was looking at disabled people holistically, but there were a lot of concerns, particularly from, unsurprisingly, service providers and parents of disabled children, that somehow certain groups of people would lose out from the transition.
Yeah, I'm just going to go back to what the title of the workshop is, Principles of Independent Living, and then pick up. So I think when we think about independent living, often people associate with social care. And I think that's an issue we need to think about. So it's about, think about getting people to think that independent living is wider than just attached to social care. Then going back to your question, which is about, well, I can't remember you phrased it. But one of the things I want to pick up on is that how did Australia get the wider society to buy in? But also here, if we look at our council tax bill, there's social care on that. So everybody pays social care in their council tax. With disabled people, we're not just paying it in our council tax, we're also paying it within our client contributions. So, in terms of your question, your point and question, are we already doing it and people just getting robbed off, ripped off?
Yeah.
I mean, it just, because you're saying of the buy-in, so how do they get the money? In many ways, everybody's paying for something into social care already. But if we think about independent living, it's wider than just social care.
I guess. So I think for me there are two responses to that from the Australian situation. One, charity, the charity model of disability. When I ask people, do you have any problems with the charity model of disability? And I was talking to activists, they were like, what are you talking about? They genuinely hadn't had the same issues that we have around disability and charity. It wasn't there to fight against. When I met with a large number of DPOs, I met with in Australia, about 9 DPOs, they were shocked when I said that it would be almost unheard of for a DPO to get an invitation to a government meeting. Because in Australia, because all of the DPOs are funded by government, they automatically get a seat at the table whenever there is any policy about disability.
Technically we should then, because we're actually funding social care. I'm just doing parallels on the point.
In relation to your second point, I guess what they did differently is, although in the UK we all pay towards social care through our council tax and through our taxes, the campaign and the discussion in Australia very much focused on making an increase specifically for disabled people and independent living. And what that meant was that there is an accountability for how that money is spent within society. That was what they were buying into when they agreed to that tax increase. The problem is that now Australia has a very similar government to ours in many respects. And now the government that's come in that has to implement this programme is saying that the previous government didn't budget enough when they came up with the tax increase, so they're going to have to make cuts elsewhere in order to facilitate the rollout of this programme.
Okay.
Ask one
Can
more
we move
question.
on? Yeah.
You said that there's some parents among the same people are losing out. I was just thinking of, for example, the situation here. I know when Scope closed some residential homes, that the people living there did not want them closed because they were going to lose their whole social group and social life from the closure. And it was just a land, a land sale type thing rather than a policy of integration that was behind it. So can you say what people are doing about where they've lost out? And also just to add, it's often the parents that are fighting for the disabled people, and that needs to be recognised, for people who, like with Winterbourne View, people who are not able to have a voice themselves.
Yeah. So, the people that were being defined as losing out were those who were already receiving a high level of support through the pre-existing systems. However, most of those systems preferenced institutionalisation over independent living. The biggest challenge, and I think it's a challenge that we'll all identify with, for those who did have strong advocacy, who could get support that they needed, there was a fear that NDIS would actually create a limit on the support that they were being given, because they would suddenly be given a budget, and actually if someone's support needs were very, very high cost, that budget is not going to sustain their support needs. While I strongly agree that parents are or can be allies to independent living and advocacy, what was very interesting in Australia, and this is a broader issue, there was a very strong belief that DPOs should do systemic advocacy, and that advocacy organisations should do individual advocacy. There was also a very strong belief, which I challenged a lot, that disabled people should not be individual advocates. So there was a very strong belief that when it came to individual advocacy, that should be done by non-disabled people for disabled people.
On what grounds?
It was, the way it was explained to me was pretty much so that there was a separation between what is happening systemically and what is happening on an individual level. I did meet a number of people that were doing individual advocacy for other disabled people as disabled people, but they were in the minority and they were discouraged from doing that because there was a sense in Australia that there should be a division between the systemic and the individual. And they were quite interested that we do it differently here.
Okay, are there any more questions either for Zara or Linda? Because if not, I propose we just go around and everybody says what their priorities are in terms of principles for independent living.
May I ask a question? You said that they were able to basically rouse the general public to vote for this.
Yeah.
How? How do you campaign? Because I think, as a non-disabled person, I've worked for Sammy for nearly 8 years. This is the second of this type of event that I've been to. And I listen to it, I listen to the things people are going through, and it makes me irate. Absolutely irate, because I think it's completely unfair, and I think it's something that, if the general public were to be hands-on and understand, it would become a human rights issue, and everybody would be bothered by it, because it's wrong, fundamentally. But the problem is communicating that to people in a way where they can actually realise that we're not talking about disabled people versus non-disabled people, we're talking about people. And there's a massive divide, I think, between sometimes fear. For example, Sammy, excuse me for using you as an example, but Sammy has a speech impediment, right? And for some people, when they first meet her, they're completely intimidated by the fact that they can't necessarily understand her. Sammy is hilarious, has an incredible sense of humour, terribly, terribly mischievous, but there's that barrier because they can't understand. No, not you, of course. Because of that barrier, a lot of her personality and all of the amazing, wonderful things going on in her mind are not experienced, and therefore understanding Sammy and the things that Sammy goes through and some of the issues that disabled people face on a day-to-day basis, it's not something that people get to hands-on interact with. So I'm really curious, how do you get an entire country to mobilise behind something that seems like a disabled issue, rather than a, it's a people issue?
My personal view is we have to make sure that they know it could be them next week. And also I think we have the dementia tax that we can use, because we can frighten, should we frighten people?
Yeah.
We can frighten
Absolutely.
older people and their kids who want to inherit their parents' homes into saying 0.5% increase in tax, anything can be inherited.
Well, shouldn't it just be fair, though?
And it shouldn't.
It shouldn't,
That is the only thing I think that will motivate people who are basically selfish, who basically don't care, and who don't see themselves as being in a situation where it will affect them.
That's not what they did in Australia.
Well,
I think what they did in Australia was they created a campaign led by disabled people called Every Australian Counts. And they categorised what they were doing as being to the benefit of every Australian. So that
I think that's what I said, really.
But they framed it as a positive, as a collective ownership of Australian identity rather than something to be fearful of.
I think the problem is when they were consulting on the Care Act, you probably all remember that the one option that wasn't allowed to be asked in all the nationwide consultations was should care be free at the point of delivery. It wasn't part of the consultation, so nobody could vote for that.
Sorry, can you just say that again?
When they were consulting, which they did massive consultations around the country before they put the Care Act in place, they wouldn't allow a question, one of the options that was available to be, should care be free at the point of delivery. It wasn't an allowed question.
But that was the coalition government.
Yeah.
So the last thing they wanted was that debate. Okay. Can we just now go round and people say, you know, I think Michelle said it, the title of the workshop is Principles for Independent Living. What is your thing? Do you want to start, Serena?
Yeah, sure. May I just make a comment on something that I said earlier? In terms of adult social care and how they increase the council tax, in my borough, I don't know if that money's ring-fenced. Do you know what I mean? So yes, they've increased the council tax, but how do I know that it's going to be used for adult social care? Yet on the other hand, they're cutting services left, right and centre. Anyway, in terms of
Do you want an answer to that?
Yeah.
Okay, so as far as I know, so they allowed councils to raise the council tax. If it was over 1.9%, they had to go to a referendum for the people. They were under such pressure around social care that rather than increasing the money from central government, they allowed them to raise the council tax more than that, and they called it a social care precept. So theoretically, that money is ring-fenced, that increase. But that money that they raised didn't even touch the sides, because it didn't even allow them to pay the additional minimum wage for care homes and domiciliary care providers. So, and what's happening to local authorities is that every year their grant from central government is being cut. So by 2022, local authorities won't have any money from central government. All the money they raise will come from the local taxes, primarily the business, as well as the council tax, the business tax. So central government will take no responsibility for adult social care. It will solely be funded out of local taxation by 2022 if the Tories get their way. Does that make sense?
Yes.
So you can see why, even though they're raising money, the amount of money and demand far outstrips the money that the government is either at national level or they will allow local authorities to raise. It doesn't add up. That's why it's being slashed. That's why that report came out, you know, and 120,000 people have died. That's because the cuts, they've rationed care, primarily to older people and to people in care homes, so people die earlier, die younger. So it's a life and death situation. Okay, I'm sure that helps, but doesn't help.
Principles.
Yeah.
Right. For me, planning, there needs to be more time, turnaround time. So from assessment to implementation, if one has capacity, time to read through, on the premise that you do get your report, read through the report and kind of can go back and challenge certain points and ask them to change it. So there's an issue around time and be a part of the process of planning your care package or whatever the case may be. More autonomy and transparency, and also an emphasis on well-being and leisure activities as opposed to work and volunteering.
Hang on.
Okay.
I can't write that fast. What was the last point?
More of an emphasis on well-being and leisure activities as opposed to work and volunteering. And my last point is the aspects of one's mental health shouldn't be used against them to negate care or negate any support. I'll give you an example if that's a bit out there. You know, let's say someone is different every day. Oh well, we're not going to allow you or help facilitate to go to a service because you won't turn up 50% of the time. So then we're not going to offer you the service anyway.
Okay, so other language, they call that fluctuating conditions,
Yeah.
which applies to mental health, but also things like progressive diseases
Yeah.
like MS and muscular dystrophy and what have you. Can I just, in the workshop we did at the last conference, the whole question, I think it's raised today by other people, and Zara raised it about Australia, is the question about assessments. And what people are saying is we want to get rid of assessments done by private providers like Atos, Capita and Maximus. But people were saying we want to do peer assessments or self-assessment. That actually we are experts about our impairments, about our lives, about our independent living. So we need self-assessment tools, if we're going to have them at all. And I suppose this is part of the debate about it shouldn't be means tested, it shouldn't be rationed by local government. It needs to be alongside the NHS with the same principles. Now we know that mental health is supposed to be in the NHS, but the same principles don't apply. If you break your leg, you go to hospital, you get sorted, if you have a mental health condition, you go on a waiting list, you never get seen, you can't get it, blah, blah, blah. So we know it doesn't work in the NHS, but actually so in terms of the principles, are there things there about assessment and who does what, when, how we do it? Can I go over there and then back to you, Zara?
I have a concept, and it's that currently it seems to me that assessments are about what people can't do, what their impairments are, what their difficulties are, and things like that. And I'm there may be some value in that. I don't particularly like being reminded of my difficulties and the things I can't do. I actually find it it sends me into a bit of a negative tailspin sometimes. So I think that's perhaps not a sort of psychologically beneficial model to engage people in. So I'm wondering whether it can be devised that there's an assessment of what people could do with appropriate support, so that actually we get a kind of positive assessment. I don't mean about like completely leaving people's basic needs out of things. I mean, currently there's a lot of pressure and there's psychocompulsion coming through the system at the moment in relation to DWP, but kind of like on a positive focus of how can we improve your life, how can we make sure you live fulfilling, rewarding lives, engagement in the community and all those things. So it's like a positive assessment of what could you do with, what could you need to get you up to this level.
Great. So that's a positive principle going forward. Okay, Zara.
My point actually leads on from something Linda raised. One of the things that I'm hearing quite a lot from the Scandinavian countries is actually in the Scandinavian countries they're experiencing the rising in threshold that we've experienced for the last decade or two in terms of who's eligible for care and support. One of the things that I've listened to lots of people and it comes out quite a lot is some people with lower support needs feeling like they shouldn't apply for care because they don't want to take away from people that have higher support needs and I'm not saying it's right, but it have higher support needs in the hierarchy of their understanding. What I'm wondering is whether actually if we encouraged everyone who has support needs to acknowledge those support needs so that we're not just talking about a really small group of people, but actually there are quite a lot of people that would benefit from intervention and support, that actually that might push it up the agenda because we as a group of people shouldn't be almost sacrificing our support needs out of awareness that other people have support needs.
Yeah. Can I just comment? I think, first of all, we need to start talking about the principles of independent living. There are principles of independent living, and I think it's about reminding people what that independent living is about. And And also, I think when we go back to the assessment is really about keeping someone institutionalised at home in many ways for many people. And it's about, and I think this came at the summit, Mark, you remember people were saying there are people who may not be known to social services and still want to have independent living. So there's those issues as well. But I think it's also as well, if we talk about the principles of independent living, when we think about independent living, it's about people in a certain group who talk about independent living. So it's how do we get independent living to become something that the wider society, basically what you're saying, Zara, that the wider society knows about independent living. Because even if people have support needs, they don't know that they need to get those support needs is about independent living. So the principles around independent living is, first of all, we have to get it outside our doors.